fact is about bad habits, no matter how you look at it, whether it's substance use or alcohol use or unhealthy eating, etc. Like, bad habits live in your brain in neural pathways, and we can't erase them. Like, that's sort of the bad news. Once you develop these bad habits, they don't go away necessarily. What can be changed, though, is adding in new pathways, adding in new habits, and ideally adding them in such a way that you're reinforcing them, and you are in a world and in relationships that are reinforcing them.
Welcome, everybody. This is Katie with Ria Health, and I'm here today with Dr. Nicole Kosanke. She is the co-author of the award-winning book, which I have here, Beyond Addiction: How Science and Kindness Help People Change. And I have loved this book. It has literally been life-changing and transformative to me. So I'm so excited to have a chance to speak with you today. Nicole is also a licensed clinical psychologist and the director of family services at the Center for Motivation and Change in New York, where she specializes in the assessment and treatment of substance use disorders in both individuals and families. And so your background is very robust and in depth. And I just really actually want to dive right in with you and begin with just asking you if you could share a little bit with us about what is in this book, and essentially, the message it shares, and what your intention was as the co-author behind it.
Well, thanks very much for having me. I'm really, it's really touching to hear when the book is having an impact in the world, because when my colleagues and I started thinking about writing this book, we were really thinking about it in terms of just having a broader reach. Psychologists end up in this tiny, in normal circumstances, we are not just doing this by video. In normal circumstances, we're in a tiny little room with one other person, maybe a couple other people, and the reach just doesn't feel that broad. Although significant, just doesn't feel that broad. And so we really wanted to bring these ideas and these strategies, especially to family members who it seemed clear that our culture was not doing a great job of disseminating research-based ideas for family members. And so as much as the community reinforcement and family training approach had this amazing research grounding for it over decades of time, it clearly was not reaching the ears of the people that could most benefit. And so that's what we were eager to do. And however, writing a book is like a mammoth bear of an effort, it turns out. And I love the people I wrote this book with, and it was still really hard and took a lot of energy and effort, and it was a heavy, heavy lift. So anytime I hear that it's beneficial, I am so thrilled, just because, it took a lot out of us to make that happen. And it's also very gratifying because I, to this day feel like, these ideas are just not reaching as many ears as I would like them to. But you also asked me what's to say something about the book. So I haven't even gotten to that yet. So the book is really our effort to bring a few, I think, very simple and intuitive ideas about what addiction is and how to think about it in a constructive way. That it so happens that science and kindness agree about some of these ideas. And that's great news when that happens. But it really is true when it comes to caring about somebody with an alcohol or substance use problem, that, that the two ideas of science and kindness really do merge. And so that's really the basic idea, is like trying to bring some very clear and I think pretty easy to understand concepts to the arena of substance use treatment.
Yeah, absolutely. And like you're saying, it's very simple and clear, yet when I was reading it, it's just a totally new way to look at addiction that is not, labeling someone an addict and telling them they need to quit right away and accusing it of being a moral failing, but rather kind of using skillful communication and mindfulness and what the evidence says to approach them in a more compassionate and humanistic way, and really gives tools for both the loved one of a substance user and the substance user as well. So there's just so many tips and tools in here that I think could really change the lives of someone who's struggling or the family member who's struggling as well.
Yeah, I mean the particular ideas around the motivation piece, I think, can be really, I don't know. I mean, it's a funny thing to say that they're simple ideas and also say that people feel like they're new to substance use treatment. But I think it's really true what you're saying, that, that there's a way in which, and this is like such a broader conversation, like the history of why alcohol is treated the way it is, sort of not within mainstream medical treatment, also not within mainstream psychology treatment. It's like its own little stepchild, eddy of treatment, and just the way we think about it is sort of segmented away from medicine and the way we think about therapy in general, which is weird. That's a long history how things came to be. That would be a longer conversation, but it's definitely true. And I work with tons of people who have a loved one with both a substance use issue and a psychiatric issue, and they are really stuck because, any treatment program that primarily treats psychiatric problems is not really that receptive to treating substance use problems, and vice versa. Like, most substance use treatment programs are not really very good or receptive to treating psychiatric problems. So you're kind of in trouble. And my experience is that, people often have both of those things, and maybe one leads to the other. And so it really is a tragedy that we don't do a better job of addressing both things at once and using the same kind of mind and perspective of addressing both those worlds of difficulties, because I think there's a lot of overlap. The idea of positive reinforcement, for instance, like that's probably the most well-researched concept in the world of psychology, and yet we don't think about it as applicable to alcohol use problems. I'm not sure why. Like, it makes perfect sense to think like, okay, if somebody does something over and over again, they must be getting something out of that. And there must be some reasoning in their mind, some rationale, some physiological experience that is rewarding them or positively reinforcing them for doing that. And I think it's, I mean, this is such a deep thing, but I think that it's something like in our culture that feels more comforting to think like, you're an alcoholic who always has been one, and you're susceptible, and it was just a matter of time. And that way, some people can feel like, well, it doesn't matter how I drink, I'm not one of those people, like there's somehow the idea of having an alcohol use disorder is not about what you drink, but who you are, that there's something inherent about a person that makes them either an alcoholic or not an alcoholic. And I think that's just patently false. That the idea of positive reinforcement is very, very important in substance use problems in a way that I think makes people uncomfortable. It's uncomfortable to think that, like, oh wait, she's getting something out of drinking like that. That doesn't make any sense to me. Why that feels uncomfortable. It's more comfortable, I think, culturally for us to think that there's something wrong and that it's just sort of constitutionally different about that person.
Exactly. And so I want to ask you, when someone is getting that positive reinforcement from alcohol or whatever substance they're using, would you say that that is coming from the logical side of their brain or something they're consciously choosing? Because I think that's a challenge for a lot of family members, thinking, they're choosing to drink or they're choosing to use. And so what's going on in a substance user's mind when they're faced with that challenge of to use or not to use, and then they end up breaking and going back to it? Can you talk a little bit about that?
Sure. Yeah, it's a really good point. I think it's so confounding for a family member to see that their loved one is making a choice to do something that feels so obviously risky, dangerous, foolhardy, whatever it may be. It seems so obvious from the outside that that's a bad choice. And yet when I talk to family members and I say, well, what do you think they're getting out of that? Like, what makes sense to them about what they're doing? Family members always understand on some level. Well, I know that it helps her feel more connected to her friends who all drink too, or, well, his job is really stressful and, at the end of the day, he just can't turn his mind off. And I know alcohol helps with that. Or, there's a big but that comes next, which is like, but there's this whole slew of, reasons why you shouldn't do that. And why can't you think about that? But the first part, usually, like, as unappealing as it is to think about the reasons why someone might do those things, usually family members get it right away. Like, yeah, well, I do understand that. And I think that that's an important thing to say, because it is hard for a family member to accept that there is that side, but they do have a lot of information about what that side looks like. They do have a lot of information about, what is really motivating their loved one to keep doing something that, also has these downsides. So why would somebody return to or continue doing something that has negative consequences? Well, first of all, that's basically the definition of a substance use disorder, is that you keep doing something even though it's causing you negative consequences. And so by definition, that's what we're looking at, is we're looking at somebody who feels mixed. They do have reasons why it seems like a good idea, but they also have reasons why it's clearly a bad idea. And they're trying to balance that out. And that's what we call ambivalence. We just call, somebody who is stuck in that place of like, well, there are good reasons to do this and there are reasons why I really shouldn't do that. And that's a state of ambivalence that is very uncomfortable. And we like to resolve ambivalence. And so you fall on one side or the other. And that results in action, right? So there's a way that ambivalence can be perceived as like the enemy, oh, well, she's not really committed, or, oh, she said yesterday that she was going to stop doing this, but there she's doing it again. Or, he had this whole conversation with me about how he really understood that it was terrible, but now there he is saying that, he's going to return to it. Like that, what is that? And the thing is that, from a family member's perspective, the downsides are so much more prominent and impactful. Whereas for the person themselves, they're really living in a skin that tells them from the part of the sort of lizard part of the brain that says like, you need this thing, you know, it's going to make you feel better, is telling them like that they need it. And so from the person's perspective, it is like very compelling, you know, and much more compelling than the downsides might be. You know, it's kind of what's straight in your face at that moment. But I think that that state of ambivalence is a really normal part of any change process. And as soon as you think about it that way, you think about substance use and trying to resolve those problems as a big change that you're trying to make. As soon as you think about it that way and kind of broaden your lens back of like, oh, you mean like trying to lose weight or trying to exercise more or trying to treat my kids in a different way or trying to, you know, any big change that you might be anticipating making. Everyone understands ambivalence as part of the deal. Like you don't, that's part of being human. And so I think once you sort of step back and go like, oh yeah, right, this is a big change and big changes involve ambivalence, then I think a whole wellspring of compassion becomes available for what that's like and how ambivalence really is a necessary part of the process.
Exactly. And, you know, in the book, it talks about how even confrontation can undermine motivation. And I'm sure that people can feel that they need to, you know, confront their loved one if they are in that state of ambivalence. But it was really interesting to me in the book because, you know, in the traditional ways of treating addiction, I feel like confrontation has almost always been the first step, you know, whether it's an intervention or just the pressure or the ridicule. But in the book, you guys talk about how this can actually hinder progress and undermine their motivation to change. So would you be able to talk more about that and possibly how, you know, like, I think people should honestly read the book because it's just a great resource, but what are some steps that someone can do when they're feeling that frustration at their loved one for using and using and using?
Yeah, I think it's a really tempting, and you know, it's tempting for a family member to think that, well, if they only understood how terrible this thing is that they're doing, if they understood it, if they really felt the weight of the downsides of the negative pieces of this, then they would change. And I think that to a degree, the whole treatment system is set up in that kind of a punitive frame of mind that if you feel worse about your decisions and you're made to feel worse about your decisions, then you will, of course, make better decisions. But of course, that's really not rational. When you, again, if you step back and think like, okay, we're thinking about trying to recover from substance use problems, and when we think about that as a big behavior change, then how would I feel making a big behavior change if somebody started attacking me or telling me what terrible decisions I'm making, or, you know, backing me into a corner of feeling like I've done this wrong and that wrong and the other thing? Well, I think most people can relate to how demoralizing that feels and how shame-inducing that is, and how being labeled as a flawed human basically is really not encouraging. I mean, if you think about any really impactful teacher that you had or mentor, you know, the words that come to mind universally for people are words like supportive, encouraging, loving, somebody who really believed in me and believed in, you know, my strengths and my abilities. And you don't, things like, you know, words like punitive and angry and loud and yelling and demeaning. Those are not words that come to mind, you know? And yet somehow we think like this is the way that we're gonna like shove somebody hard enough that they really, you know, realize the error of their ways. And it's just not true for most people. I mean, look, there are certainly people that come to me and say, you know, give it to me straight, doc, you know, like just tell me, like, I don't want to, you know, I don't want you to tiptoe around the issues. If you see something, like, I really need somebody to give it to me straight and, you know, tell me really what I'm doing wrong. Or if they think that, you know, I'm telling them BS, like, call it out. But the truth is that even for people who are explicitly asking for that, in practice, what I find is that's not really true. Like, people don't really want to be yelled at and, you know, corrected in that way. It's sort of it fits with like the intervention HBO show or something, you know, that's very dramatic. And I think our culture like has this love affair with like a dramatic change, you know, like started raining and I just knew that, you know, life had to change in this way, you know what I mean? Like there's this sense that it's so romantic to think that you could change in that way and lightning strikes and we're off to a new world, you know. It's just not like that for most people, you know. Most people like make a change and then they go back to the old ways for a while and then they make a change again and then they start to think like, oh, maybe this is worth it after all, and like people are nicer to me over here in this new way of behaving, and so, you know, maybe it's worth it. And then you know, like that's a much more realistic and common way of making big changes, is in that gradual sense. As romantic and exciting as it sounds to really like know the truth and be told, you know, no holds bar, this is the way it is and you got to do this and this is why, like it's just not so much like that, really.
Yeah, absolutely. You explained that really well, and I'm laughing over here just at the scenarios that are out there. It's true. So I want to ask you too, because I keep referring back to the book just because it is this wealth of knowledge, and there are kind of two things in here, because you're talking about, you know, encouraging the loved one to communicate in a positive or empowering way as opposed to a demeaning way. So that all sounds really nice in theory, but I know it can be really challenging for someone who is really fed up with their loved one who's been struggling. But you know, in the book, it talks about the positive communication, and it also talks about the importance of self-care and learning how to care for yourself as the loved one or even as a substance user. So can you talk a little bit about, you know, what that dance looks like when someone's learning to communicate in a more positive way, even in small ways, you know, not making those off the cuff comments that they know are insulting. So learning how to communicate in a positive way, but at the same time, you know, learning how to take care of yourself and realize you have boundaries and needs of your own.
Yeah. Yeah. I think I'm glad you're raising that because, you know, the effort that it takes to make a change on the family member's part, you know, if you're used to thinking about something in a particular way, you're used to communicating in a particular way, you're used to interacting in a particular way, it's really hard. It's really hard to make changes in those things. And, you know, we often see a parallel between like what the person trying to make changes in their alcohol or substance use has to go through and what the family member might have to go through. And sometimes that parallel is helpful to point out or just recognize, because it helps the family member have some empathy for what their loved one is going through, and vice versa. So, you know, if I'm working with a family member and their loved one who's trying to stop drinking is in treatment with us, we often hear both sides of the story, and we can build empathy for each other through that work of really recognizing, okay, I'm learning how to do this differently. And it's hard. It's, requires a lot of self-compassion that, okay, there's a reason why I started behaving this way. It was because I was scared that my loved one was going to kill themselves or kill me, or, endanger our lives in some specific or general way. And that makes sense to, like, have strong emotions and be yelling, or, trying to turn up the volume or turn up the heat on my loved one until they, like, really listened to me. And so there are really understandable reasons why I got into this pattern of behaving this way. And I think that self-compassion is an important first step to just acknowledge, like, okay, I'm reading about these new ways of communicating. It sounds like a really good idea. I can see how intuitively it makes sense. But let me take a step to just to take a beat and recognize, like, but there are reasons that I got here, and they're pretty valid reasons. And that fear can lead us to feel really like this is an urgent matter that requires yelling and screaming, and whatever is required, whatever comes out is what's required. So that, I think, is important, to just take that beat and have some compassion for yourself as a family member. And then the other piece is just to recognize, like, you are only going to be as helpful or compassionate or creative in your problem solving and your thinking about how to do something differently if you are taking care of yourself. Like we talk about, like, making sure that your gas tank is full, like not going on a long journey assuming that a quarter tank is going to do you. It is not going to suffice. You got to stop. You have to take rest breaks. You have to fill the tank up again. And you have to keep doing that. It's not like, oh, I ate breakfast and so then I don't have to eat the rest of the day. Like, that's actually not how it works. You have to keep filling your gas tank up. You have to keep noticing that your shoulders are really tense from, dealing with stressful situations, and therefore I should be stretching, or therefore I should be taking a walk, or therefore I should be talking to my best friend because she helps me relax and feel better. Like, these are things that actually matter. And if you don't take care of yourself, it will make you a not so great helper. Like, that's just if we're thinking about, like, what it takes to be the best, most efficient, most creative helping person. If we're thinking about you as a human being, like, if you don't take care of yourself in a chronically stressful situation, like we're often dealing with substance use, you will develop, stress-related illness. I see it all the time. And so it's a really serious matter, and it's something that parents in particular are really vulnerable to not attending to as well as they ought to. Because, that, whatever that phrase is, like, I'm only as happy as my unhappiest child. Like, you just feel like, I hear parents all the time telling me, well, let's just focus on getting him better, and then I'll do what I can to, go to the doctor and take care of, what vitamins I should be taking or whatever. That's not a great strategy. It's like saying you're going to run a marathon, but you're, not going to bring any water with you. Like, it doesn't, you could do that for a sprint. You could do that even for, like, maybe a quarter marathon, but you can't do that for a full marathon. You're going to run out of gas, and you are not going to be a helper anymore, but you're also not going to be healthy. You're really going to damage yourself in the process. So it feels like you're making a choice between either I take care of my kid or I take care of me, and the two cannot meet. But that's not actually how it works. Something really striking to me about some podcast I was listening to recently, where she said, like, there is no arriving at a balance. She was talking about, like, work-life balance, like work and family life, and especially now with COVID and, kids at home and all this stuff. there's no arrival place. There is no balance. It's like a teeter-totter where, like, can you pause time? Well, yeah, if we had the power to do that, you could do that and maybe balance there for a few seconds. But actually, it's a constant effort to try and find balance. It's a constant process. It's not an arrival place. And somehow that's stuck in me because I think that it's similar to me about this issue of, like, do I take care of him or take care of me? It's actually has to both be happening. They both are influencing each other. If I'm helping him, I feel like a good parent, and that makes me feel better. But I also have to help myself, and then I'll be more rejuvenated to think in a different way for him. And so this is a long answer to your question. I feel like there's so many pieces to it for parents. I think it's a very prominent issue. For partners, it's kind of a different kind of issue too, because it feels like your peer is supposed to be helping you too. And so you don't have that peer engagement, and it's not the same thing. Like, parents understand, like, it's my job to take care of my kid. Like, that's the deal. Like, I signed up for it. I had this kid knowing this is how it goes. But when you marry someone, you expect that they're going to be taking care of you as well as you're taking care of them. And in a long life, of course, that's true. But right in the heat of substance use problems, it sure feels lopsided. And that's understandable that people feel like, I can't actually take care of myself and take care of my partner at the same time. Like, it's really taking a toll. So there's no, like, magic bullet answer to how you do this, but I think it requires self-compassion. It requires remembering why your loved one, because it's very, I think it's very stressful to think that your loved one is doing something that's insane. Like, it's really stressful. Like, oh, I don't know what's going to happen next. Like, why is he doing this? It's crazy. Like, what can I expect next? It's just insane. There's no logic to it. But when you sort of, like, ground yourself in, like, actually, I know why he's doing this. I have a sense of, what the reasonings are. And although they don't seem like they don't make as much sense to me as they make to him, there's still some, like, calm that comes with, like, just thinking about what makes sense about this. And I think that is a self-care strategy, actually, to remind yourself of what makes sense about this and to not be stuck in the panic of, like, oh, crazy, 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 I can't take it, That's stressful. And I think it's also, when we talk about communication, you've mentioned a couple times, like, the book has a lot of, like, specific strategies around that I think, and there are other books that are really good. There's a book by Bill Miller called Listening Well that I recommend to anybody that I ever speak to, probably. That's so good. He's the person that developed motivational interviewing, which is one of the therapeutic modalities that we write about in Beyond Addiction. And he wrote this book just, like, last year called Listening Well, and it's got really great, very specific strategies for communicating. And, communication is, like, I don't know, like, I just said to some family members today, like, I want people to focus on positive reinforcement and noticing what their loved one is doing well and what they appreciate about them, like the specifics of what it looks like when they're not using, like how they feel with them and what it looks like and how much they appreciate it and what they notice that feels good to them and all of that stuff. Like, I want people to be as specific as possible in their positive reinforcement, and that requires words, communicating specifically. And that is helpful for the person themselves to realize, oh yeah, like, I do this interacting with human beings better when I'm not using drugs or drinking. Like, I am more present, I am happier, I am more connected. my parents, like can engage with me. I don't argue as much. All that stuff is true. And getting the positive reinforcement for it is helpful to that person. But as a family member, it's also really reassuring to hear oneself notice the positives, because then you're sort of rounding out your experience of this relationship. If all you're ever doing as a family member is going, you're doing that wrong, and this is terrible, and stop doing this and start doing that, you feel the negativity of that as much as they do. And so I think it's another piece of, it's not a huge piece, but it's another piece of self-care to push yourself to say something positive, not something made up, something real. It has to be real, that you really feel genuinely like that. I really appreciate when you did that or said that, or the look on your face when we were having that conversation really let me know that you were listening, and that felt really like I felt really cared for and appreciated that. That is helpful to me in noticing it, because it reminds me that there are really positive things about the relationship and about this person, and kind of rounds out the relationship in that, if that makes sense.
Yeah, it definitely does. And I know there's at least one example in the book of a couple where he was kind of doing things to positively reinforce her good behavior, and then kind of step away when the bad behavior was coming back. And so it was interesting to read that real life example and how it played out. You mentioned motivational interviewing, and so I wanted to ask you about the 3 evidence-based treatments that you guys use at CMC, Center for Motivation and Change. I know you have CRAFT, motivational interviewing, and ACT. And so did you want to talk a little bit about those 3 and how they are different than traditional treatments like AA and Al-Anon?
Sure. So those 3 approaches are what we kind of pulled from, because they have such strong research background, and a lot of studies showing us that they have an impact with people. And so we pulled those strategies together from CRAFT and MI and ACT to make what we call the invitation to change approach, which is what the foundation, we have a nonprofit, the Foundation for Change. So CMC, Foundation for Change, is a website that has a lot of information also. But we use the invitation to change approach and pulling from those different models, because they're very focused on this concept of positive reinforcement and noticing what it is that we can do to enhance the positive aspects. And the fact is about bad habits, no matter how you look at it, whether it's substance use or alcohol use or unhealthy eating, etc. Like, bad habits live in your brain in neural pathways, and we can't erase them. Like, that's sort of the bad news. Once you develop these bad habits, they don't go away necessarily. What can be changed, though, is adding in new pathways, adding in new habits, and ideally adding them in such a way that you're reinforcing them, and you are in a world and in relationships that are reinforcing them. And so the strategies that we use in the invitation to change approach are pulled from these different models. The CRAFT approach, community reinforcement and family training, is really specific model from Robert Myers that is targeting family members. So that is very specific to family members who are worried about a loved one who refuses to enter treatment. And so a lot of the strategies that we talk about in Beyond Addiction are really at the heart of it is from the CRAFT approach. But we also added in, as I said, the motivational interviewing pieces, especially around communication, because as I was mentioning about his book, Listening Well, is that, these strategies are sort of bringing positive reinforcement into the communication sphere and identifying how is it that we can actually use words when someone in front of us is ambivalent, so that that person doesn't end up feeling like they need to defend their negative behavior. Because inadvertently, this happens all the time. People don't mean for this to happen, but it happens all the time that somebody in front of them is ambivalent, feels mixed, not really sure they want to make changes just yet. And then in the process of speaking with them, they end up defending their negative behavior. And why would that be? That it happens as a process of the communication between two people. And if you are leaning heavy on one side of the teeter-totter, then the other one goes up. Like it's sort of a natural interactive pattern that if you are sort of come down heavy on one side, don't you think you should change? Really, you're going to be much happier if you do change. The natural impulse is just to say, yeah, but, there's this other thing. And so the strategies with motivational interviewing are very specifically targeting that moment of time when the person is ambivalent and you don't want to say things that make them dig in to their position, and help them sort of explore their ambivalence and sort of side with them in the sense of being empathic and allowing them some space to kind of play with, well, on the one hand this, on the other hand that, tell me more. Oh, well, this and that, to stay in that ambivalent place long enough that they can resolve it, ideally in a healthy way. But, to stay out of the way of somebody doing that process is kind of a nuanced thing that normally we would be talking to therapists about how to use these strategies. But Bill Miller from Motivational Interviewing really brings it into a layperson's terms as well. Like, how can everyday people use these strategies in their communication? And then ACT, acceptance and commitment therapy, is in part brings in this concept of values. Like, I think we tend to forget, I don't know, there's so many pieces about the substance use treatment world that are unflattering, really, when you get down to it. And that's a very kind word for what I see happening, unfortunately. But there's a way in which, like, family members are encouraged to be angry and to cut someone off, or don't give in to, don't be enabling, don't be codependent. Like, there's so many don'ts thrown at family members, that, I think this piece about, like, what really matters to you as a family member, as a parent, like, what about this person matters to you? What about being a parent matters to you? What kind of parent do you want to be? Do you want to be a really punitive parent that's kicking their kid out? I don't think anybody says yes to that question. Like, and yet that's not the question that we pose to people typically. But when you do pose that question, you think about what really matters to you. And if the answer is like being an empathic parent, that my kid knows they can come to me no matter what's going on, well, then I have to start thinking differently about how I communicate, even if they're doing things that scare me. I have to think about, like, how do I say things in a way that makes me a receptive person for them to come to? How do I make myself a person that has an open door to communication, even if the information they have to share with me is frightening? So that's where ACT comes in, is to think about the values part of this.
And you talk in the book also about staying engaged in the treatment. That is a different thing than enabling. And I know you kind of have different perspectives on as you shared, kind of enabling or what people are supposed to do when their loved one is still using. But I guess what's the difference between, being engaged in their treatment and loving them and caring about their well-being versus enabling? Because I think that people feel like there's like a blurred line there. And if they're being
Yes.
nice, then they're enabling them. So how does someone navigate that territory?
Yeah, super, super challenging. I think our culture at large is so confusing on this front and really does a disservice to these ideas of helping. And certainly does a disservice to family members who are really struggling to be helpful and don't want to do the wrong thing. And, when you tell somebody that they're being enabling, it's so demoralizing. Here I am trying my best to help, and now you're telling me that helping behavior is enabling or codependent. Or, right? I think codependent, honestly, is such a terrible word, because it just really makes people feel so bad about themselves. It's not just like the behavior is codependent, you are codependent. Like who you are is flawed. It's really, I mean, that's a whole other discussion, I guess, but clearly it pushes my buttons. But I think that I have a lot of compassion for family members who feel stuck around this, is what I mean to say. Is like, if there's a lot of mixed messages out there about you should cut them off, but do an intervention. Those are opposite things. But somehow we give parents both of those messages. So I think there's a lot of mixed messages, and it's really hard. There's no clear line in the sand that will help people feel sure about whether they're doing the right thing or the wrong thing. But enabling is doing something that increases the likelihood of the unhealthy behaviors continuing. That's what it is. And there's lots of ways that gets very confusing very fast. Like, I pay for my kids' rent, and sometimes they're doing things that I think are unhealthy, like using substances. So am I enabling them? Well, if they're not doing anything else but using those substances, then I guess I am enabling them to do those negative things. But I'm also enabling them to have more of an independent life. And I'm also enabling my family to have a less stressful life by them not being here. And I'm also enabling them to potentially live closer to their job where they need to go. And I'm also enabling them to be more responsible for figuring out how to live an independent life beyond just rent, like paying bills and, understanding how that banking works and, writing checks. I don't know if anybody writes checks anymore. I'll just make that up. But what my point is that there's lots of ways that a helping behavior can enable negative behaviors, and it might also be enabling positive behaviors. And so I would love to just take back that word, and I acknowledge that it can mean the support of behaviors. And sometimes those behaviors are positive and sometimes they're negative. So I think the main thing to be thoughtful about, that most people don't hear enough from treatment providers, is that there are lots of behaviors that you can participate in enabling that are really helpful, like strategies for managing stress. If I say out loud, I had a really tough day and I'm going to take a long bath. I don't want any interruptions. I'm going to read my book, and then I'm going to spend a few minutes walking around the block and talk to my sister, and then I'm going to come home, and then I'll be available to you guys. If I say that out loud, I am both enacting, as long as I do it, I'm enacting positive, healthy response to stress, and I'm also role modeling that for my kids, for my partner. That is a multi-dimensioned strategy for conveying and enabling other people to learn how to manage their stress in my family, right? So those are things that I don't think we give enough credit to, because that's a learning process. Why do many people start using substances and drinking? It decreases stress. It decreases anxiety. It does. That's what alcohol does. It brings down your anxiety. It's very effective. I mean, I don't think we should mince words when it comes to like what the positive impact of substances are, and alcohol will do that. It also has all these downsides that we want to avoid. And so it's not a great strategy for managing anxiety. And it certainly can go haywire if it's the only strategy you have. So the things that family members can do that are really helpful is to enable positive behaviors, to support and role model positive behaviors, small to large. How about drink refusal skills? Do your kids ever see their parents refusing a drink? Do they know how it's done? Do they know how to say it? What words would they use? Can they make a joke about it? Like, teenagers need these skills. They need to be able to say like, I'm good. What are you, obsessed with that thing? Like, put it away, honestly. They need words. And the best way for them to have words is to hear it from other people around them, to hear it. They're not going to hear it on watching TV, that's for sure. Like, my God. So you need, as a family member, to offer them strategies. That's enabling positive behavior. So I think when people talk about enabling and codependency, I kind of veer the other direction. Like, we've all been talking about that. Let's talk more about like, how do we really enrich and give more support and nourishment to these positive behaviors that will, eke out the space that is left for the negative behaviors. It will shove it out. The more flowers you have in the garden, the less room there are for the weeds. That's just how it works. And you want to figure out how to water those flowers without watering the weeds. It's not just about going into the garden and ripping out every, weed you see. That's sort of the kick them out, throw them in rehab kind of approach. Maybe sometimes that's necessary, for sure. But also you need to water the flowers. That's a big piece.
Yeah, I think a big part of what you guys offer at CMC and in the book too is just like skillful communication, because like you said, the words, like we don't have the words or the tools and how to navigate this. And I think we've been told for so long that, you're an addict, you got to go out and get treatment. There's nothing I can do, but there's so much we can do as the loved one next to them, that I think you guys provide like a roadmap to how to navigate these tough conversations. So, one of the last questions I wanted to ask you, you were kind of talking about it as far as like what a loved one can do for someone who is struggling. So is there anything else you wanted to say there as far as like first steps someone can do if they've got a loved one that's struggling and they don't know how to approach the situation?
Sure. So there's a lot of resources that we've tried to put together that you can find on the CMC website, Center for Motivation and Change website, also on the CMC Foundation for Change website. The 20-minute guide, THE20minuteguide.com, has a bunch of little exercises, kind of homework stuff that we put together right after writing Beyond Addiction, because it's sort of like homeworky stuff that came out of the book. So that's a good resource as well. And there's one of my colleagues, Dr. Josh King, he does a podcast called The Beyond Addiction Show, which interviews a bunch of experts in different areas of, like eating disorders and thinking about cannabis use medically and recreationally. Lots of different really great interviews there. And there's also a YouTube channel and a Facebook page. I guess there's a bunch of things. I'm not a huge Facebook person, but now in the age of COVID, this is like what we're doing, right? Is we're doing all this stuff. So there's all those different approaches, and I think whatever main message that I would have for family members is to know that there is help out there and that you're not alone. And a lot of people feel like it's an obstacle, especially now, for them to go to an Al-Anon meeting, and they maybe have been told, like if you go to your pediatrician and say like, I'm afraid my kid is smoking pot, they're very likely going to tell you to go to an Al-Anon meeting, or they're going to tell you to go to a therapist to take care of yourself, and that therapist may know nothing about substance use. I'm sorry to say that's very likely. And so those are not the only two things available for you to do. And I think that's an important message, because Al-Anon is super helpful for a lot of people, but it doesn't work for everybody. And especially right now, online, people feel very nervous about going on meetings on Zoom. And, we have to just accept that that is an obstacle for people and not get into fights about like, no, it's really the only way to go. Like, of course, it's the only way to go for some people, but it's not the only way to go for all people. And just accept that that's the case and provide options for people to have, because it really is important that people not get stuck alone in their own head and tell themselves a lie, which is that they are uniquely dealing with this issue. That's just not the case. Lots and lots of people are dealing with this issue, and you do have people out there who have had similar experiences. So you're not alone. There are a lot of resources available. The only answers do not lie in Al-Anon and interventions and therapy even. Like there are other ways of going about finding information that can be helpful to you.
Yeah, and I will link all those resources below. And I know this book talks a lot about self-care, and I think it's an act of self-care to get this book and look into the resources you've provided, because it's just really empowering when you have the tools and the foundation to better communicate and you don't feel as helpless over this. So yeah, thank you so much for speaking with me today. I really enjoyed it and just got so much out of it. And I appreciate all your insights and knowledge, and just helped so much. So thank you so much for being here.
Thanks for having me. I really appreciate it.
All right. Talk to you later.
Okay.
Bye.
Bye.